Hello, Chiza. Hello, community. How are you today?
Hi, Steffi. Hi, community. Always good to see you, my darling.
Oh, so wonderful to see you. I think it's a false start.
Oh,
Didn't look
yep.
like it went
It
live.
says the meeting is now streaming
Well, let's
live.
have a look to see if we are live. Let's refresh
Oh,
our.
I've got a little notification that we were, and then it's
Oh
gone.
my goodness, amazing. We're live. I
Oh,
thought a
we are?
little error came up, but we are good to go. We are golden. So
Fabulous.
excited because when something goes right, technology speaking, it's always a good day, isn't it?
Hey, honestly,
I'll take
it,
it.
it, any time and every time, because the number of times it doesn't work. So this is good. Yes.
I love it. How are you today? It's been a long day, hasn't it?
It
Full of
has been
action.
a long day, but a good day, a really fruitful day for me. So yeah, no, happy. You were in clinic today, were you?
Yes, absolutely. In
Mm.
clinic and loving it. It's my favorite place apart from ABIC. And today, actually, we were just talking about before that I was in clinic and I was talking to my therapist about the very topic that we're talking about tonight, and
Mm.
that's menopause. My
Menopause.
goodness me,
Yeah.
you are such a treasure in this industry, Chiza. What
Oh.
you are doing right now is very transformative. It's extremely innovative. It's so new, and yet you think, Chiza, that you would have thought, my goodness, our primary target market almost is women between the ages of 35 and 55 to 60. And we're sitting here and the penny dropped, and it dropped to you for a while ago, that they're premenopausal, menopausal, and postmenopausal, and you have now dedicated a lot of time and effort to specialize in this space. My goodness,
Mm.
what drew you to this incredible space?
Do you remember, Steffi, when gut health was a thing? When we first started talking about gut health all those years ago?
Oh my goodness, yes.
And no one really made the connection
You're a
then.
pioneer back
And
then.
now they're talking about it like it's always been talked about.
Yeah.
And then it was nutrition, the fact that food really does improve skin health. And now it's menopause. And I've grabbed the mantle because we're all in this industry and we have the women coming through our doors. We see them. I'm lucky because I'm a nutritional medicine practitioner and I'm a dermal clinician. So I've got them on the treatment couch talking to them, or they're sitting in front of me. And I see firsthand, I hear firsthand what they're going through. When I'm doing a facial and they hear that I'm a menopause coach, the first thing they say is, "Oh my God, I was so meant to have you." They are desperate for help. And I think for me, the reason, I'll always be an educator, I think, but the reason
Mm.
why I have grabbed this and I'm on my soapbox about it is because I don't think collectively as an industry that we actually make the connection between aging skin and menopausal skin. I don't see that we make the connection between aging skin and estrogen deficient skin. We just know there's aging. We've got aging reversal treatments or rejuvenation treatments, but we're not really looking at what estrogen deficient skin means or what it looks like. And if we did stop long enough to consider it, we would not be treating it the way we do
No.
because it's a skin that is inflamed.
Mm.
Wound healing has slowed down. It does not bounce back the way that a younger skin does. And if we think of it as estrogen deficient skin, even just hearing that term,
Wow.
we know we've got to tread nice and gently, but we don't do that. And so I just want everyone in the industry to take a step back and really understand that you might be a young therapist, but you've got women who come to see you every day of the week who are in that category that you described, sort of late 30s, moving into 40s, 50s, and beyond. And it can start younger than you expect.
You have made me so aware of that, painfully and profoundly aware of that, because I'm in that I'm
Yeah,
in that age group, right?
yeah, yeah, absolutely. Yeah. People still think it's too far away. Oh, my mom, my grandma. Yeah, there's still a lot of time between where I am now and that over there.
Mm.
But your clients are going through it and they need your help.
Chizzy, you're so far ahead of pretty much every trend that I know ever since I've known you. And even before that, before I knew you, I knew who you were, and I knew that you were talking about gut health, and you know, that's maybe one of the very first times I had experienced, you know, your teachings and things like that, and I became a true fan, a follower of what you do. But the education that you provide, but the way that you provide that education, the way you talk through it, the meaningfulness, the love, the passion, everything, and the amount of detail that you put into your training is quite remarkable. I don't know how you actually remember all of the things that, I mean, it looks like you remember them from love, but how do you remember all of it?
I think I just am passionate about it. I devour as much as I can about topics that I'm passionate about. And because it is something that is deep within me to share, it's easy to convey that information because it has impacted me so profoundly. And I see women who are not doing so well. And I know that every therapist has women who are not doing so well.
Yes.
But they haven't asked any questions. So she comes in, she has a facial or she has her injectables and she leaves, but she is desperate for help.
You know that
Are we
actually,
frozen, Steffi?
I'm still
Are we
going. I can see
frozen?
you. I can see you definitely, and I can hear
Steph?
you. I think we've lost
Okay, good.
Chiza.
Okay,
Oh,
good.
now you're back. Oh, I
I'm
spoke
here.
too soon when I
I'm
said thank
here.
you.
Yes, I was asking.
Can you hear me?
Yeah.
Oh,
Yeah.
wonderful. Because I spoke too soon when I said there were no tech
Mm.
difficulties, didn't I? I jinxed the lords of the of tech. But basically,
Oh dear.
I was trying to think when you were talking, I was putting myself in that situation. You know, I have treatments all the time. I wouldn't you know, I wouldn't go without a couple of weeks without having something done. I have clinics, so I'm privileged to do so. But I know the trajectory change, like I'm 49, I know the trajectory change on my skin through having treatments, but all the while I'm thinking gut health, I'm thinking inflammation, I'm thinking all these things, but I'm not thinking premenopausal. I'm not thinking that at all, Chiza. And I guarantee
No,
many
no.
experienced, very, very well trained therapists are sitting there going, oh my God, do I really even need to know this? Absolutely, you need to know this. I think this is a game changer, like gut health was a game changer, right?
Without a doubt. Without a doubt. This is the next big thing that's going to hit our industry, without a doubt. And because we are in charge of the skin, the largest organ of the body, right, we know more about skin than a lot of these doctors know about skin.
Yes.
Right? And I'm not saying that to be insulting.
No.
The way that we know skin and the amount of time that we spend with our clients means that we get to know them on a very intimate level. So how can we know them intimately and not know what they're going through? But I think for me, the biggest thing is knowing that estrogen decline causes oxidative stress to increase. Where there's oxidative stress, there is inflammation. How is that impacting the wound healing process? When you space your treatments out, are you spacing them out further apart for a menopausal woman, or are you doing it every 4 weeks as you would routinely do it with a younger skin? It's
Considerations, my goodness.
It's things like that that we need to think about. The fact that wound healing slows down. When we think of all of the different factors involved in the wound healing process, cell proliferation slows down. Hydration levels are not there to allow for communication between cells. You know, we're not even thinking about those things, but then you're going to say, oh, or she will say to you, I didn't get a great result. Or you will say, oh, that product doesn't work. We're not impressed with it. But have you considered the health of the skin that you're working on? You know, I just think it's going to profoundly change the way that we look at skins in that age group.
The way
because I
we
think,
assess, the way we assess and consult
yeah,
our patients
yeah,
and prepare them, because we get to see them a lot of the times. Some of my clients have been with me, and I know this, clinic owners and salon owners will be the same, seen their clients for years and years, and
mm,
some of them have been with me for 15,
um,
16 years, right? Even longer. And you see them through, mid 20s, and then they're
mm,
40 now,
mm,
seeing them through all that time. And you're speaking to them, you're seeing how their skin's changing, you're seeing the changes, you're understanding, you're noticing, you're trying to adapt to them, but without properly having the knowledge to be able to consult them.
that's right.
We're talking about gut health, we're talking about all those things that we've been taught, but really there's no one in our industry, except you really, who is actually made the connection when menopause, skin, I need to put these two together and then create a new education, a new type of training, a new way to consult, so that we can retrain all of our therapists this new way. And this, you've been working on this project for how long now?
It's been bubbling away in the back of my mind, but just trying to find the right time. And I think last year was when I made my decision to just take the bull by the horns and do it regardless of the outcome, because I feel that we all owe it to our clients to learn more about what she's going through so that we can better serve her.
Mm.
You want to have clients who are going to be with you, like you said, Steffi, for 10, 15, 20 years, rather than clinic hop trying to find someone who can help them because they're not happy with where they've gone. I think it's also something that you cannot keep to yourself, because there are billions, 1.1 billion women will be going through menopause. They said it was 2025. Now they've kind of moved it a few years along. But very, very soon, there are more of us moving into this age group. And menopause, even though in Australia the average age is 51, can happen as early as in the 40s. So we sort of say between 45 and 55. But the youngest person that I know was a woman, a young girl, 16-year-old, who had her ovaries removed because she had a tumor. So she went into menopause at 16, with the risk of cardiovascular disease, osteoporosis, and all of the different associated I'm just thinking, not necessarily, it can be disease states or states of ill health, if you like, the risk of type 2 diabetes or dementia risk, or, I think of women who come in and see the real dramatic changes in their skin in menopause. In the first 5 years, we lose 30% of collagen, we lose 10% of bone mass. And then 1 to 2% every year going forward, we continue to have this degradation happen, right? So for women, when they look at themselves in the mirror, what they see here is real. But what about vaginally? What about cortisol levels going up, cholesterol levels going up, dementia risk? The number of women that leave the workforce every year because of unmanaged menopausal symptoms, 10% globally. Women walk out of their jobs at the peak of their careers, not because they're ready to retire, but because they cannot think, they can't remember, they can't articulate, they lose their words. These are professional, high-flying women who suddenly lose their confidence. So who is this woman coming in to see you? What's going on with her? You're doing a facial, you haven't even stopped to ask her what's going on. It's not right. And they want to talk. They're desperate to talk because there is so much conflicting information out there. Oh, my doctor said I shouldn't do this. Oh, my doctor said I should. They don't know where to go. And I just feel that because we're in the fortunate position of having someone's attention for at least an hour, we can listen to them and say, hey, I've got some information for you. This here is where you can go. Do you know there's a chair that you sit on for 10 minutes and it stops urinary incontinence? Do you know that sex that is so painful, there's something you can do about that? There is just so many resources out there that I feel that we need to know about. It's also for some clinics that are looking to expand and move more into women's health, there's such an opportunity there as well. I'm just so excited because I see us expanding what we do and making it more older women friendly if you are a young clinician, or if you're a team that is, I mean, already I've started to see people, I have a meal plan for menopause, and I'm getting a lot of people buying the meal plan because they want to include it in their memberships. So clinics are looking at ways that they can diversify their services. You know, it's a very exciting time. And I just feel that, and the reason why I'm passionate about this is because I see us being at the forefront and playing a part along with the doctors and the nurses. We're all in this together, but we definitely have a part to play.
We need to start with education because, Chiza, we don't know. Our industry just doesn't know where to start with this. We need guidance. We need someone who can hold our hands. We need someone who can tell us, look, this is where you start. This is where you progress. This is where you head. This is how you consult. This is the formula. This is the tools. And you have that. You have a program to be able to coach, help. You're not just giving this information to your clients. You're gifting, you're beautifully, generously sharing this information with all of us. And you're going to be doing this as well through a big symposium, first of its kind in Australia, dedicated solely to menopause. This is a huge deal, Chiza. This is game-changing stuff. Tell us why you decided to do a symposium. And it's so hard because I know we did the ABIC conference twice in a row, and wow.
Yeah, it's a daunting task, but I feel that the menopause woman deserves it. But I also think that getting doctors, nurses, and therapists together in one place in front of experts. I have got the former president of the International Menopause Society speaking.
Oh, that's incredible.
I have got a urogynecological surgeon speaking. I've got Dr. David Kosenko, who is the president of the Australian Cosmetic Physicians Association, speaking. So I have got amazing speakers. Dr. Shauna Watts is speaking. So these are people who do menopause. They know menopause inside and out. And I want us to come together so that we understand how we can create a roadmap for our team, knowing how we can put programs together for our menopausal clients, knowing how to organize our consultations so that they really touch on the things that we need to find out before we do our treatments. So it's a one-day event, and it's on the 24th of February next year. And I made it next year so that it gives us enough time to block out. And I've also made it Afterpay. I've enabled Afterpay as well, because I'm really, really passionate about making sure that we all come. It's going to be a day of just insight, collaboration, networking. You may not be menopausal, but your mother is, your sister might be, your cousin might be, and your clients.
Your clients.
A lot of them are.
Literally, maybe half to three-quarters of your clients are. Yeah, the majority are. Yeah. And perimenopause from 35 is when the decline starts. But we haven't really thought about, you know, because the girls are young, they think it's far away. Mid-30s is when the decline starts. So the more you know about it now, the better equipped you are. Someone said to me once, oh, yes, of night sweats, but nothing serious. I've now sailed through menopause. And I remember saying to this lady, we were doing a Zoom call, and I said, you haven't, with a straight face. I said, no, you haven't sailed through menopause. And she's looking at me as if to say, oh, and I said, no, hot flushes and night sweats are the least of your worries. It's the fact that bone density changes have started. It's also the fact that your cognitive health has changed. Insulin resistance goes up without you doing anything. Gut bacteria completely changes. So that, me talking about gut health back then, gut health is a big focus of menopause. They don't just happen when you visibly see them. They're percolating away, and silently
change is happening. She then went and got a bone scan. She's 52. She has the bones of a 70-year-old, full-blown osteoporosis.
Oh my goodness.
So these are things that yes,
You
these are
can
things that we don't
intervene,
even
you
think
can
about,
intervene
right?
early, can't you? Like a person that's say,
Well,
you
you
know,
can.
in their 40s, late 40s, say, can you intervene at that point?
Well, even she's 52 and yes, she can intervene. So I have a little mini trampoline that I rebound on, and that can improve bone mass. Weight bearing exercises will improve bone mass. Optimizing your hormones, regulating hormone function, holistic approach. And that's why I'm doing this, so that we don't just think of it as, oh, well, I do skin needling. What about her gut health? What about inflammation in the body? We've got to know, we're talking about being holistic therapists. Well, this is part of that holistic, conversation as well.
We need to know this.
Mm.
This is not a negotiable.
We do.
Everyone
No, that's how I
that's
feel.
listening, no, everyone that's listening right now, and we are going to be, I mean, we're standing behind, as ABIC, we're standing behind this conference, 100%. It is a one, when I say a one of its kind type of conference, it is a game-changing conference. It is something that people are not talking about, but we desperately need this information. This is not a negotiable, and there are only a limited number of tickets, because you, of course, now, before you've done the big release of tickets, you already started selling them beforehand. So my advice is they are going to sell fast once we start to promote this, because this is just the very beginning of us talking about it now. I guarantee that in a couple of months' time, if you want a ticket for this, maybe even sooner, you probably will miss out. So there are a limited, you're having a beautiful, the most beautiful venue, by the way. Oh my gosh, my mind was blown when I saw it. It's the State Library in New South Wales, and there are only a limited amount of seats there. And if you don't get your tickets soon, I fear that you're going to miss your chance for, honestly, once in a lifetime thing, because you only get to see this once. You only get to be a pioneer one time. And if you, as a clinic and as a clinic owner and as a therapist, get to be the pioneer of something, if you get in early enough, you are the one that has the more experience. You're the one that has the higher market share. You become the expert, and you will be able to create something extremely special whilst everybody else is trying, like, not even thinking about it and catching up. You're meanwhile setting up yourself for, being able to serve your clients better, but really expanding and taking your practice and clinic to the next level, really. I think we're a little bit frozen, Chiza.
Because mark my words, as I said, menopause. Oh dear, am I back? It hasn't been great, huh?
Back. I think there's a
Is it still
little bit of
frozen?
I think there's a little bit of internet
A
issue.
lag?
A little bit of a lag, yeah.
Oh dear.
That's okay. We've got you still. That's the important thing.
Okay. No, I was just saying, because mark my words, menopause is, everyone's talking about it. Women are not shy or embarrassed to talk about menopause anymore.
No.
They want help. They want to have vaginal tightening. They want to have, the aid of a chair to help them with their urinary continence. They're looking for ways to feel better about themselves. And there is so much that we can do. I know we focus on this face, but there's also that face, so just come and learn, come and immerse yourself, really understand why hormones are not as scary as we've been led to believe. Because that's another thing that I'm passionate about. Just get all the information and then make up your mind.
I don't think it's a choice.
Am I frozen?
You're just a little bit laggy, but we've still got you. We've definitely still got you. I don't think it's a choice. I mean, women are becoming more educated. We have an aging population anyway. Longevity studies are increasing. So we are, as a population, going to be living longer. There's a whole movement towards age reversal. And one thing that they're not talking about in the age reversal process is the fact that women go through a different aging process than males do as well. We're talking about longevity, right? If you're talking about reversing cellular age on a real level and wanting to, measure your age as not 55, but as 45, if you want to reverse time, if you will, we're doing it with aesthetic treatments, but we're not doing it well internally as we could be. And we're treating the symptoms. We're constantly catching up to treat the symptoms of
Yes.
what's happening internally inside.
Yes.
So I'm going to have treatments because I'm noticing laxity in my skin. I'm noticing bone loss. I'm noticing that I'm having to fill, where I'm losing my bone. But if I didn't lose that bone in the first place, I wouldn't have to fill as much. And of course, there's
Absolutely.
only a certain limit where you can fill, and you need surgery. If we can
Mm,
keep
mm.
ourselves rejuvenated for longer, every treatment that we do, we're going to respond differently to. Think about this though. If a client comes to me, Chiza, and she's premenopausal, menopausal, or postmenopausal, what happens when I am then treating them for a condition, like say pigmentation?
Mm,
And I'm
mm,
going in and I'm doing multi-therapy approach. I'm doing laser to clear the skin. I'm doing
mm.
skin needling to rejuvenate. I'm doing all these things. And I'm not thinking and I'm not understanding that possibly that treatment plan that I have for everyone, because I know that that treatment plan's a multimodality. I'm doing great because I'm combining different treatments together. I'm not understanding that I actually then need to put in possibly PRP in there, or possibly low level laser in there, or possibly something else, because this is a menopausal skin and they need extra. They need more help, more cellular renewal help as a part of their process.
Yeah,
And am I thinking maybe they also need supplementation, hormone therapy, all those other things? I'm not thinking that right now, am
absolutely.
I?
No, no, we're not
None of us
thinking
are.
that way at all. No, and we're thinking in her membership, she can get X, Y, and Z, and you've got all the big guns in there. But you're not thinking that oxidative stress means chronic inflammation, means upregulation of matrix metalloproteases that are going to start to break down the very collagen you're trying to stimulate.
Yes.
There is no way that she is equipped to handle all of those treatments if you have not looked internally and provided antioxidant support, managed her stress levels, got her hormones optimized. That is a big thing. Estrogen is actually anti-inflammatory. Without estrogen, she's in a chronically inflamed state. That's what drives inflammation and disease. So you're working at cross purposes if you're trying to rejuvenate the skin, but meanwhile, the fabric, the foundation is weak. You can't. The same way people, it's a no-brainer. Skin health equals gut health. We don't even think twice about that. We get that. We've got to know that in menopause, the gut microbiome shifts dramatically, right? Chronic inflammation is a thing. So you have got to treat holistically. And that's where looking at lifestyle measures, looking at her sleep. Sleep is so important. I ask my clients on a scale of 1 to 10, where does your stress level sit? Oh, 20, she says, without batting an eyelid. It's got to be a much deeper conversation than just saying, oh, menopause treatment plan. This is what you get for the month if you pay X amount. In the end, she's going to be dissatisfied and she will go looking elsewhere until she finds something that she didn't get from you. So it's about setting it up properly, understanding exactly what happens in menopause, and then thinking, my gosh, yes, I'm about to enter menopause. This is going to be my niche. We are not going to run out of women. Menopausal women, they're not
Definitely
going to
not. They're
finish.
increasing.
They're increasing. A lot of women that I spoke to one yesterday, and she's like, oh my God, I'm going to create a menopause plan and I'm going to have your drink in there. And I'm going to, she's got all of these amazing ideas, right? But she was so excited because that's who she wants to serve, because she is menopausal and she wants to attract those women. But it's not just going to be a fluke. You have to set yourself up so that you've got a bit of a plan. You have a consultation form that asks the right questions so you can find out whether she is on HRT. And if she's not, you can come and learn about HRT and why it's important so that you go back equipped. I want everybody to leave the symposium with a list so that when you have a client coming, you can go, oh my gosh, Mary, go and see this person. You need to contact, I want us to be empowered. That's what I want. I'm excited because I know the day is going to be amazing.
Oh,
And I
I'm
want
so
everybody
excited.
to come and
I've
go,
booked my staff to go.
yeah,
Everyone is going to have this
yeah,
this
yeah,
training.
yeah.
As I was saying before, it's not a negotiable. The reason that it's not a negotiable is I go to a lot of conferences,
Mm,
a lot of symposiums. We are conferenced out. There are so many
I
conferences.
know.
You're thinking you're all listening to this right now. I can actually see the viewers on there on here listening, and you're all thinking this is another conference, this is another symposium.
Yeah.
You know that we really haven't had any new information in our industry for many years. And I know people are thinking, what are you talking about? We've heard new information. Actually, no. We've been talking about the same treatments, the same protocols in a different way, spun around in a different way for a few years now, several years. There's not been really a lot of new information coming out, except in the longevity field studies. So if you look at Dr. David Sinclair and all the work that he's doing on age reversal, so cellular real age reversal, and menopause. Those are two of the things that are also very, very, very linked for women
Very
because
linked.
one doesn't happen without the other.
No.
This is the real game-changing
Mm,
thing. So when I say we haven't had new information, the new information is more better understandings, more clarity, things like that, but nothing that can dramatically change the trajectory of a woman's aging the way that treating menopause correctly
mm,
can, and the incredible the results. We're talking about taking a treatment plan that you would get good results, and you're thinking you've got a great result here,
mm,
to the next level, but really to the next level. It's
mm.
not just, hey, this is a kind of new approach that we're taking. It's a revolutionary approach that you're taking, completely different.
Yeah, but also, Steph, we have to work collaboratively because we can't do it on our own. That's the thing, right? You might think you're doing your needling and that's it. No, she needs more than that. So
Mm.
this is why I want the nurses, the doctors, and us to come together. I've got someone who's going to be speaking about mental health. I've got my little checklist. I'm like, okay, this person's speaking about this because I want us to really understand everything that she's going through so that we're better informed. But you're not going to get that by listening to a podcast. You might get one little bit of it, or going on Instagram and following, a doctor on there, you'll get a bit of it. But I wanted this to be industry relevant because we all have the same woman as our focus. And we all do treatments to rejuvenate the skin and get her feeling fabulous, but we can't do it all ourselves. So it's about you forming a network so that you can collaborate. I've got a urogynecological surgeon who's speaking, amazing woman. And she said to me, can you tell me where I can send my clients to with aging because they're complaining about their lines and their wrinkles. So
Wow.
this is a great way that we can forge these connections because she does pelvic floor repair, but her clients have wrinkles and lines that they hate. She doesn't know where to send them. She said, Chiza, it's so nice to know you're a nutritionist because someone came in with weight issues and I was looking on the internet for someone to send her to. And I was so embarrassed because I had no one to send her to.
That specializes especially in menopause nutrition.
But see, so this is what I'm saying. The time is ripe and right for us to forge these connections so that these doctors will send their patients to you, right?
Mm.
I'm just loving the fact that as an industry, we are all working a lot more closely.
Isn't
It
that
used to,
beautiful? I mean, it's just so, and obviously you're a clinic member, sorry, an ABIC member right from the beginning,
mm,
when we first developed or put together ABIC,
yes, you
right
guys have
from
done an
you've
amazing
been,
job,
and
amazing job.
it's a collaborative effort, and you've been so, wonderfully supportive all the way through because you understand you are an advocate for unity. You're an advocate. Our very first conference, we had the panels of, so many diverse
Yeah,
professionals within our
specialists,
industry,
yes,
right?
yeah,
So we had, from beauty therapists, dermal therapists, orthopedic
dermatologists,
nurses, dermatologists, so forth, all in
mm,
one panel recommending.
yeah,
But it's from people such as
brilliant.
yourself that we all learnt this concept of collaboration and how
Mm.
shared skills and shared knowledge enhances what we do. We're not being so precious over our little niche, but expanding to allow referrals from other sources into our business and then referring to.
Yeah.
People are a little bit worried about that. They're like, oh, are they going to take, my client, or is that? It's actually not if you find the right people with the right intention and you join together. You actually have
Yeah.
something magical, and that's what you have in your practice.
Yes, yes. And I cannot endorse that anymore, because what you said is absolutely spot on. It's not about keeping someone close to your chest and thinking you're going to lose her. It's about, or him, it's about getting the best results for them by working collaboratively, right? You will have them stay with you for life
For
when you
life.
work this way, because they can see that you've got their best interest at heart. And like I said jokingly before, you're not going to run out of female clients. There are hundreds of thousands of women who are desperate for help. So it's about, and this is why I'm doing this, because we need help. We need help with these women. These women are desperate for help. And I just see that in our industry, there is so much potential, but we need to see it for ourselves and know, do you know what? No, what she's saying is actually true. I do see these women with, their wrinkled faces. If I just gave her a bit more in the consultation, what else would I learn about her?
Mm.
When I was a dermatological trainer, 15 minutes was considered the maximum amount of time that a clinic owner would give her therapist to do the retail consult
Consultation.
at the end.
Wow.
We tried to explain that they needed 15 minutes in the beginning and then 15 minutes at the end at least. But the clinic owner,
Oh, we did have you freeze.
sorry,
We're having you freeze. Oh no. Right when I mean, everything's juicy that you're saying, but right when you were getting to the point.
Steffi,
Yes. Can you see
Steph?
me? We've had you freeze a little. I think you'll come back. Don't lose hope, people. She'll come back. Oh, there we go. She'll pop back on in a sec. Your connection's a little bit weak, I think. Whilst we're waiting, I think everyone can actually still hear me when you're
I'm
ready to jump back
sorry.
on. That's okay.
Was it bad? Was
I
it?
just wrote. Well, you froze on a gorgeous face, so that's good.
As long as it's a gorgeous face, as long as it's a gorgeous.
I love that. I love it. Look, we're talking about this symposium. You know who is already coming, and whoever's listening to this is already coming, is other leaders of our industry are already coming. They already understand that this is the place to be.
Yeah.
So if you're watching this, all the leaders in our industry are already coming. I'm going, a list of
Maria's
people are
going.
coming. Yeah, Maria Cocciolone's going. You name it. We've got not just ABIC Council going, but we've got leaders in the industry wide are all already signed up for this. Be a leader in your industry. Be the pioneer in your space. Be one of the first to know about this and hear it from the person who's made it her mission to study it and actually knows skin and knows how to bring the two together. If you want the information about menopause, go to the right source, go to the person that's actually doing it and doing it well and has been doing it for a long time. As I said, we've got early bird now until 1st of August.
August, yeah.
Yep, 1st of August. So now you have a chance to actually get a great early bird price. Because Chiza hasn't gone far and wide promoting this just yet. So it's just early bird right now. If you sign on before 1st of August, after that, there will be a big campaign that's going out and it's going full price. So
and there's afterpay. Remember, there's afterpay. So you can pop it on afterpay.
You know what? You're smart for doing that because at the moment, you're thinking, well, we're all thinking, oh my goodness, another expense, another conference. But you just pop it on Afterpay and then think about it later or think about it in installments. But this is going to, okay, let's talk business for a sec. We're talking about empowering, changing lives and everything. And it's so important to talk about that. But let's talk about, I'm a clinic owner, you're a clinic owner, or everybody a lot of people that are going to come are owners of clinics or they're professionals that want to increase their business as well. Half of it is we need to do the best thing for our clients and we need this information desperately to be able to serve them better. But the other half is we're not a government run facility. We're a self-funded businesses here. And why should we learn about this? Because it is definitely an enhancement to your revenue and enhancement to your clinic and salon. It is something that you can add on, consult on, develop treatment programs for, I suppose, model your attention around the journey for your clients, educating them about their menopause, and then adapting your practice to that will increase your revenue. And right now it's like latest modality this, flashy new product that, but they're not getting that wow factor of, oh my gosh, I need to be committed to this clinic. And we're seeing a lot of, clinic hopping.
Clinic hopping. Yeah, they do. David Kosenko, who I mentioned before, is one of the speakers. He was saying that he adapted and adjusted the way he was doing consults. He was saying a 50-minute consult just doesn't cut it.
Really? Well, we've lost you again. Chiza, if you want, I'm going to keep staying on this link.
Are you back?
Because you've frozen, if you wanted to jump off and then jump back on again, you might reset, and I'll stay on the link and keep talking about how fabulous this area of training is. If you want to jump off and then jump back on, if you can hear me, that would be wonderful, because then it probably will reset your Zoom. But in the meantime, while we're waiting for Chiza, I tell you what, I was so moved the first time I heard Chiza talking about this, because I'm experiencing the symptoms as well. But I just looked at my clients today. Are you there? I was saying I looked at my clients today when they were walking through the door, one after another, one after another. All of a sudden, my attention was, she's premenopausal, she's menopausal, she's postmenopausal. And I'm telling you, a good 80% of my clients fell into the exact
my attention was
the exact category that we're talking about now. We did have some younger ones coming through. I had a couple of 20-something-year-olds coming through. But the vast majority of our clients were, that slightly mature age. And I thought to myself, if I knew right now, and I was equipped with the training that Chiza will give us, if I was equipped with that knowledge, how differently would we be consulting these women? How differently we'll be consulting our patients right now if we're armed with that knowledge. And I thought to myself, you know what? We have to wait until next year to get this knowledge. But I still think, even though we wait till February next year to get this knowledge, we're still going to be the first out there. And I am chomping, like literally chomping at the bit to get this knowledge and having consultations with Chiza, because it is such a fascinating, game-changing area to be in. That if you're watching this, I would not hesitate to go on Chiza's website right now and buy the tickets. Are you there, Chiz?
I'm here. I'm so sorry.
So it's Thriving Through Menopause, right? So we lost you, but you're back now. It's Thriving Through Menopause, and your website is Thriving Through Menopause.
Thriving Through Menopause. .com.au.
Perfect. So hop on there.
Should I pop it in the chat?
Actually, I can pop it in the comments so everybody can see it. It's thrivingthroughmenopause.com.au. I'll pop it in the comments now so everybody can have access. You've got early bird. You've also got VIP tickets. So if you want to be one of the ones right up the front and get a consultation with Chiza, and an incredible goodie bag, which a luxury. It's not even a goodie bag. I can't call this a goodie bag. This is like a luxury, $1,000+ bag. That is like a wow factor. I'm going just for that alone. No, I'm joking. But it's a beautiful experience as a VIP. I encourage you. There's only a really limited amount of VIPs there, and they are getting snapped up really quickly. But regardless, get your spot, because because it is going to be a first of its kind. She's like, can you hear me still?
I can. I just feel so bad that I dropped out. Internet.
Is there anything that you want to tell us before we wrap up this incredible conversation about menopause? And obviously not the only one, because we will have you back again very soon.
We don't know what we don't know, but one thing we do know is that we have got menopausal women and perimenopausal women coming through our doors. We want the best for them. And the way to work out exactly what they need is to understand what goes on in menopause. It is more than what you think. The way that it impacts a woman psychologically, physically, it impacts your treatment outcomes without you even being aware of it. Come and arm yourself with knowledge so that you can feel more confident starting the conversations and then getting to the crux of her issues, sorting out her problems, and having her inviting her friends to come and see you too, so that you can set yourself up as the person to go to for skin health, etc., in your area.
That's beautiful. Thank you so
Mm.
much, Chiza. You're always such a wonderful supporter of the industry. We'll have you back again
Thank you, my love.
very
I'll make
soon.
sure that I'm somewhere where the internet connection is better. I
I
promise.
love it. Thank you, everyone, for joining in.
Thanks, everyone, for coming.
Yeah,
Thank you.
it was a great one. Bye,
Thank you,
everyone.
love.
Thank you, Chiza.
Bye. Thank you, darling. Thank you.
Bye.
Bye, everyone.